So this one, the continuation of our first, the previous class. So the normal blood gas analysis, if I talk about the normal blood gas analysis, means we have to collect the blood and then we have to check the pH. The pH means hydrogen ion concentration, and the normal range is 7.35 to 7.45. And second one, the partial pressure of oxygen, and the normal range of partial pressure of oxygen 80 to 100 millimole per liter. And here the pressure of carbon dioxide, the partial pressure of carbon dioxide is 35 to 45 millimole per liter. This is a normal range. And partial pressure of bicarbonate ion, this is 22 to 26 millimole per liter. And saturation of oxygen must be more than 95, right? So in some books say 94 to 100%. Now I'm going something very important for NCLEX board, super duper important. Okay, and if you do not understand these basic things, it would be difficult for us to answering some hard question from NCLEX board. And I said, try to get me. If you do not understand, please let me know. I will recap it. So here I'm going to from easy to hard. First of all, pH. What is pH? Is the hydrogen ion concentration. It indicates acid or base. The normal pH is 7.35 to 7.45. Simply, everybody know that. And you say, yes, I know it. But just keep in mind this note. Note number one, if the pH is less than 7.35, less, it is acidic. If the pH is more than 7.45, this is alkalosis or base. So in the exam, if they give us the scenario, a patient came to you with shortness of respiration, or a patient came to you with diarrhea, after blood gas analysis, you found the pH is 7.15, means 7, it is less than 7.35, means it is acidic problem. Another question, a patient came to you and patient has a COPD. After blood gas analysis, you found the pH is more than 7.45. At least to see the pH concentration, you can make it short. There are 4 options: A, B, C, and D. A, respiratory acidosis. B, respiratory alkalosis. C, metabolic acidosis, and D, respiratory alkalosis. When they give you the scenario like this, and after blood gas analysis, only can see the pH less or more than normal, higher level, higher one, you can differentiate out of 4, only make it 2. Which one is the answer? If the pH is less than 7.35, answer must be metabolic acidosis or respiratory acidosis. because acidosis means pH level must be less than 7.35. If we see the question pH is more than 7.45, answer should be out of 4. You make short 2. More than 4.5, alkalosis, metabolic alkalosis or metabolic acidosis. So only can see the pH. There are 4 options. You can exclude which 2 should be the answer. Then think which 2 should be. But before to go next level, I want to share something more here. So another marker is the P partial pressure of oxygen. The normal range is 80 to 100 millimole per liter. If the patient is oxygen pressure or O2 pressure less than 80, we have to give them oxygen simply. Or if we see that saturation of oxygen concentration in the blood less than 94 or less than 94, we give them oxygen. So the oximetry, the device, small device, we put the patient finger and we can check the saturation of oxygen. So if we can see saturation of oxygen is less than 95 or 94, we give them oxygen. Sometimes a question come to the board. So what is the most here? So this is the pulse oximetry. We can check the patient oxygen level. Sometimes board asks a question, which patient you have to see first? Prioritization. The patient whose oxygen saturation rate less than 95%, we have to go and check it first. I mean, give them oxygen first, because minimum intervention and maximum output. Give them some oxygen and you can save the patient life. So you go first and give it to oxygen, save your patient. Here is the second important point. NCLEX board asks, if there are 4 patients and the patient do not have any respiratory disease or COPD, the saturation of oxygen is less than 95% or 94%, we go and give them oxygen first priority. But a patient has a history of COPD from the childhood and saturation of oxygen is 90%. That times this is not the priority, because the patient who have the COPD from the childhood, the patient who have the asthma from the childhood, their saturation is oxygen less than 94 or more than 89% is normal, right? And so out of this 4, saturation of oxygen we have done to talk. Then we also talk about the partial pressure of oxygen. We have to check. If it is less than this, we take measure. Now go focus out of these 3, the big 3 player for acid-base management. So I already told you the pH normal range this. If less than 7 point, it is acidic. If more than this, alkaline. So a question on the bottom, you say it is the hardest question for NCLEX board. right? So the pH showing 7.20, carbon dioxide concentration 64, and bicarbonate is 26. I said I do not to check this too fast, just to see the pH 7.20. It is less than 7.35. So must the patient has a problem, either respiratory acidosis or metabolic acidosis. Just see this pH. Second question here, pH is 7.50. Is it more than 7.45? If the pH is more than 45, means patient either respiratory alkalosis or metabolic alkalosis, because pH is more than this. At least out of 4, we can make short 2. Now we can think which one is the answer. The question number 3 here, pH 7.30. So 7.30 means less than 7.35, means my patient either respiratory acidosis or metabolic acidosis. So just only see the pH, we can exclude which two may be the answer. At
Excuse
least.
me, Dr. B. Excuse me, Dr.
Yes,
B.
yes.
So to determine whether it's acidosis or alkalosis or whatever, there has to be a blood work, right? This
Yes,
is based, okay, it's the blood work that is gonna show the levels, right?
yes.
Okay.
Okay, so now another, before to go carbon dioxide, bicarbonate or carbon dioxide, I want to recap something. Okay, as I told you before, or today, the first class, if your patient has a metabolic problem like vomiting or diarrhea, means metabolic problem. So if patient has a vomiting or diarrhea, always metabolic problem. And I said sometime we have to memorize some basic information. It can make you easy to answer the NCLEX board question. So if patient has a diarrhea, always metabolic acidosis, because fluid loss in from lower GIT. So keep in mind, anything except vomiting, like, or suctioning, metabolic acidosis, like diarrhea, I said. I'm again want to recap it. I said if patient has a vomiting, means fluid come through the upper GIT. Patient has a metabolic alkalosis, vomiting, I said. So vomiting, or sometimes use the suctioning or pyloric stenosis. Pyloric stenosis, all are the problem the upper GIT. If patient has a problem the upper GI tract, gastrointestinal upper GIT, like vomiting or suction tubing or pyloric stenosis, all metabolic alkalosis. So any problem related to the vomiting or suctioning or upper GI is alkalosis. On the other hand, if patient has a problem with the lower GIT, like diarrhea, lower ending portion of the GIT, diarrhea, loose motion, they have a metabolic acidosis. So anything except vomiting or suctioning, metabolic acidosis, anything except. So if we make it easy, if we remember like this, it can help us. And another problem, if patient has a diabetic acidosis or ketoacidosis, patient has a metabolic acidosis problem, right? And also, on the other hand, talk about the respiratory problem. As I told you, the respiratory, if the breathing is too fast, like marathon runner, they have a respiratory alkalosis. If the breathing is too slow, this is respiratory acidosis, right? So here I said as too fast means, as an example I'm giving, when the blood gas values or analysis would expect to see, you can see hyperventilation. Hyperventilation means breathing is too fast. When breathing is too fast, we said respiratory alkalosis, right? Now we are going the second note for the day. Very important. Keep it in mind, my friend. Very important, I said, right? So what we learned up to now, at least one point you have to tell me. Don't neglect it. The normal pH range. I'm recapping it because it's important. pH, it is a 7.35 to 7.45. If pH is less, acidic. If pH is more than 7.45, alkaline. This is the note number 1 for the day. Note number 2. Note number 2, I said, okay? Note number 2, if the, not if, now go here. By partial pressure of carbon dioxide, right? So keep in mind, when we take the deep breath, like this, deep breath, what we take from the environment? Carbon dioxide. Where carbon dioxide go? Our lungs. So partial pressure of carbon dioxide. This is the marker for respiratory problem. If carbon dioxide is less or more, like the normal range of carbon dioxide is 35 to 45 millimole per liter. So if the partial pressure of carbon dioxide is not in this normal range, means my patient has a respiratory problem, right? If I said this is the question number 1, partial pressure of carbon dioxide is 64. Carbon dioxide is 64, so it is more than 45. So I first of all, 2 note here. When the abnormal, or first of carbon dioxide is the marker of respiratory problem. And what are the normal partial of carbon dioxide? 35 to 45. 35 to 45. Carbon dioxide is the marker for respiratory. Now go note number 3, most important for the day. Bicarbonate ion. Bicarbonate ion. Bicarbonate ion is the marker for metabolic problem. If we see the carbon dioxide, bicarbonate are not in the normal range 22 to 26, right? If it is not in the normal range, maybe the problem metabolic. But if we say carbon dioxide is not 35 to 45, respiratory problem. So what we have to know from here? We have to know the note here. Carbon dioxide marker for respiratory problem. Second point is that what is the normal range of carbon dioxide? 35 to 45 millimole per liter. What are bicarbonate ion? This is a marker for metabolic problem. What are the normal range of normal bicarbonate ion? 22 to 26. 22 to 26, right? Normal range here. So now go third stage. First of all, when a question come, if any scenario like this, analysis the blood gas analysis like this, they give us three numbers: pH, carbon dioxide, and bicarbonate ion, right? First of all, to see the pH, we can find out it is acidic or alkaline. Like first one, pH is 7.20, acidic problem. 2, A, B, C, D. Maybe my answer either respiratory acidosis or metabolic acidosis. When find out this respiratory or metabolic, we can check the which one is the normal and which is abnormal, right? So like here, carbon dioxide 64. This is not in normal range, but bicarbonate 26. This is the normal range. So bicarbonate is not a big problem. Problem is carbon dioxide is too high, and we know carbon dioxide is a marker of respiratory problem. And before to see the pH, we see the acidosis, and carbon dioxide said is respiratory. So problem respiratory acidosis. And something is important here to remember. This is called Rome method. ROME. We are coming about this little bit later. Now I said like another example, question number 3. The pH 7.50. When pH 7.50 means it is more than 7.45. So it is alkaline problem. Alkaline is two, either respiratory alkalosis or metabolic alkalosis. Which one? We can check carbon dioxide or bicarbonate ion. Carbon dioxide is a marker of respiratory, and bicarbonate ion the marker of metabolic. So out of 3, I'm question number 2, pH we checked. Carbon dioxide is 35, means within the normal range. So we are not any headache because they are normal. But bicarbonate is abnormal. It is increased. Bicarbonate ion is a marker of metabolic problem. And already we find out to see the pH metabolic alkalosis. Question number 3, the pH is 7.30, less than this, so it is acidosis because less than this. And carbon dioxide is 38. Carbon dioxide is 38, means it is within the normal. Normal is 35 to 45. So carbon dioxide is okay. So maybe there's no more problem in the respiratory. But bicarbonate ion is less. It is only 18. It is normal is 22 to 26. So First of all, acidosis problem because it's less than 7.35, and carbon is normal, so there's no respiratory problem, and bicarbonate is abnormal, so this is metabolic acidosis. So in NCLEX
Sir,
board exam,
sir,
yes,
7.50 is more than, so I think it will be alkalosis.
7 point
7.50 if you're doing number 2.
number 2, 7.50.
Yeah, I think you just said metabolic acidosis.
No.
He
You
was
can
doing
set
number 3.
number
Oh,
3 or
okay.
number 2.
Okay, my bad.
Okay. So, okay, first of all, here, okay, the third rule for here, this is called room method. What is room method? It is not for all students. If you are interested, you can catch up. Okay, room method, what said? I'm just sharing with you. R for respiratory, okay, and O for here oxygen, and M for O for opposite, and it is the other way to remember. Respiratory opposite, metabolic equal. What does it mean? I'm trying to explain on the other way. Okay, what I'm explaining, this is a one way, just simply answer the question. But different way I'm explaining, it is called room method, right? So respiratory acidosis. Okay, first of all, I'm done to finish the alkalosin acidosis, but the second option, some students prefer this one, room method, they like it. I'm explaining. So room method, this is respiratory opposite, metabolic equal. Okay, so what does it mean? Like respiratory opposite, metabolic equal, me. I'm going to me analysis first. Metabolic equal, what they said. You see, metabolic acidosis, metabolic alkalosis, they said equal. So if the pH reduce, bicarbonate also reduce, because bicarbonate ion is a marker of metabolic problem. If the metabolic alkalosis pH increase, bicarbonate also increase. So they said metabolic equal. What does it mean? Means pH down, bicarbonate down, same, equal. If the pH increase, bicarbonate increase. So metabolic acidosis, all are down, pH down, bicarbonate down. So when we talk the metabolic acidosis, bicarbonate talk, carbon dioxide no matter, they are always normal. And when metabolic alkalosis all are up, means pH up, bicarbonate ion up more than 26. So it is called metabolic equal. pH down, bicarbonate down. pH up, bicarbonate up. But in alkalosis, they call RO, respiratory opposite. Means when respiratory acidosis, means pH is down, but carbon dioxide go up, opposite bicarbonate ion. And respiratory acid alkalosis, when pH down, Then bicarbonate go up, opposite, respiratory opposite, metabolism equal. pH here is down, here is down. But respiratory acidosis, pH down, bicarbonate up. But respiratory alkalosis, pH is go up, but carbon dioxide go down. So some student like Rome method, means in relation to the pH, what are the other marker? Just opposite. If pH down, other marker go up. If pH up, other marker go down or go up. But in metabolic acidosis, both are equal. pH down, bicarbonate down. If pH go up, bicarbonate go up. So what we learn here, normal pH range, okay, normal bicarbonate ion, and bicarbonate ion is the marker of respiratory, and carbon dioxide is the marker of respiratory, and bicarbonate ion is the marker for metabolic. So this is the normal range we have to remember for exam. And NCLEX board do not give up any flow chart to remember. We have to remember